Well, welcome everyone. Welcome to a new day for Minnesotans on public programs who want to seek dental care. I'm Dr. Sheila Riggs, Chair of the Department of Primary Dental Care at the University of Minnesota School of Dentistry. We gather together today for all on the call to have a greater understanding of what is in the historic bipartisan legislation that passed in June on the topic of dental care and Medicaid. And it has been a long time in coming. For years, all of us speaking today knew changes were needed to increase access to dental care, but there wasn't consensus amongst this broad set of stakeholders on what was the best way forward. So in December of 2019, we all decided we needed to get to consensus. We shortened it to, we needed to get to yes. All of us, safety net clinics, patient advocacy groups, the Minnesota Dental Association, the Department of Human Services, all of us came together to gain consensus on the best way forward. It took over 50 meetings to achieve this consensus, but we got to yes. And today, you will hear about all that the bipartisan legislation contains, thanks to Senator Benson and State Representative Liebling. In closing, I want to do a short shout out to 3M and their government affairs team. We were all losing a little steam in the summer of 2020. It was at about meeting 25. That finish line was looking a little blurry, but right then, 3M, under the leadership of John Pornor, offered as a community service to turbocharge our efforts by teaching us the process they use around the world to successfully advance public value. It literally is called a playbook for public value advocacy. So using this playbook, we determined 4 legislative improvements that were needed. And I will now turn this over to Commissioner Jody Harpstead to discuss what the historic improvements are.
Well, thank you very much, and good morning, everyone. We've been talking a lot about disparities in Minnesota lately. Many people are unaware that Minnesota has had oral health disparities for years. The state has long had a 2-tiered dental system. Those who have private insurance or who can afford to pay out of pocket see dentists, and those with low incomes who need public health programs like medical assistance and Minnesota Care often go without. 1 in 4 Minnesotans get their healthcare coverage through medical assistance and Minnesota Care. This healthcare coverage includes dental benefits, yet the low-income Minnesotans served by these programs have had difficulty accessing dental services. This lack of access to dental care impacts everyone in the state, but especially people in greater Minnesota and our kids. More than 60% of children served by the program did not see a dentist in 2020, and dental issues remain the #1 reason for kids missing school days, pre-pandemic anyway. We know dentists want to serve their community regardless of patient income, but they were hamstrung by low dental reimbursement rates that meant they simply couldn't afford to serve low-income patients. We needed a comprehensive approach that restructured both the administrative and payment structure for dental services to address these disparities. Governor Walz and the legislature have finally put teeth into the state's ability to create dental health equity with the recent historic dental package, which includes a 98% rate increase for all dental services in our public programs effective on January 1st, and an ongoing 20% additional increase for critical access dentists. Simplifying the payment structure by paying all dentists the same rates for the same services, making credentialing requirements the same across all plans. Setting a goal to have at least 55% of all public health plan enrollees get a dental visit every year, making reimbursement rates publicly available, creating periodontal disease coverage, and creating a dental home pilot program. Many years ago, I served for 12 years on the Delta Dental Board of Directors alongside my fellow board member, Dr. Sheila Riggs, now chair of primary dental care at DU. There she taught me that there is no health without dental health. Imagine my delight when I walked in the door at the Department of Human Services as commissioner to find her chairing our Dental Services Advisory Committee, who's been working for a decade to reform dental care in our public programs. Thank you, Dr. Riggs, for your leadership in so many ways in paving the way for better dental care for all Minnesotans. I'm also grateful to Jogo Hees, Manager of Benefit Policy and Rates, and PJ Weiner, Manager of Alternate Purchasing in the Healthcare Administration of our department, who have also worked for a decade to reform dental care in our public programs. I'm thankful for the work of the Minnesota Oral Health Coalition for their ongoing commitment and dedication to advocating for these much needed changes and their partnership in finding effective ways to move forward together. And a special shout out to the critical care access dentists across the state who have been the safety net for dental care for Minnesotans for so many years. I'm grateful to Governor Walz and Lieutenant Governor Flanagan for putting the dental bill in their budget proposal this past year. And I want to particularly hold up two strong legislative leaders, Representative Tina Liebling and Senator Michelle Benson. Both have served for years on the Health and Human Services committees of the House and Senate, and both have chaired those committees for years. It takes something to serve on these committees with all their complexity, and these two have put in the time, the study, the experience, and know what they're doing. They both wanted to pass a dental bill this past year and wanted to see greater access and greater accountability. The labor and delivery process for this bill was one of the toughest this spring, but I believe that also led to this bill having 5 or 6 components that each on their own would have made this an historic bill, but together make this bill really groundbreaking. This historic dental package falls in line with the focus of the new Minnesota State Oral Health Plan. Focus areas in the plan include increasing access to timely, culturally appropriate, geographically suitable, and financially viable dental care, and making oral health care accessible, safe, respectful, and timely for all Minnesotans who seek it. I eagerly await the positive changes that will take place in our state as a result of this work. Thank you.
And I want to echo the commissioner's comments and thank Chair Liebling and everyone on this call for the work that they did to make this historic investment in dental. Minnesota had chronically had some of the lowest reimbursement rates for MA dental. And by putting money into the system, raising the standards, and giving providers the tools that they needed to both be held accountable and be acknowledged and paid appropriately for the services they provide, we're going to have a significant improvement, I believe, in oral health in Minnesota. I was primarily concerned about kids getting that early engagement, and I think that we're going to accomplish that over the next several years. As we come out of COVID, we see the importance of preventive care, and dental has to become part of our preventive care conversation because it impacts so many other areas of life, not just quality of life, but health overall. And I hope that Greater Minnesota starts to see rapid uptake and opportunities for innovation thanks to this investment and the standards that we're holding our providers to. So thank you all very much for your work.
So thank you, everybody. This is really exciting for me. Thanks for having this event today and putting a spotlight on this really important work. I'm Representative Tina Liebling and represent part of Rochester and chair the Health Finance and Policy Committee in the Minnesota House, which is a great privilege to be able to do that. And so I also want to add my thanks to everyone who worked so hard to improve access to dental health in this last session and for so many years before that, as some of you have pointed out. And I also want to thank those who have helped to educate me over the years about the importance of dental health. And I think legislators generally across both bodies and across both parties understand that the mouth is part of the body, and that as I've heard Commissioner Harpstead say in the past too, because I think we've all been educated, is that you can't have good health and have bad teeth. It just doesn't go together. So I'm so thrilled that we were able to make significant improvements in this legislative session. I especially thank you, Commissioner Harpstead, for calling out the DHS staff who work so hard on this, who are so often behind the scenes, and they crunched the numbers over and over and over during this process to help us figure out this package. Because, and this is a great package because it has both rate increases, which were desperately needed, as Senator Benson and I both knew, and we've known for a long time, but also reforms that were also needed. So these are things that go together very well. Oral health has been a big concern for me, for Senator Benson, for many of us in both parties and both bodies for many years. But until now, we really didn't make very much progress. And obviously the work behind the scenes by all of you was extremely helpful to getting us to yes this year. We were always told the rates were very low, but because we run our healthcare programs mostly through managed care organizations, the legislature actually had very little control over the dental rates, and there was very little accountability for access or outcomes. So transparency was extremely important to me, and in this package, we got a lot more transparency and accountability. There will be a lot more work to do going forward, but I think that we've set a really great direction, and I'm so pleased with what we were able to accomplish. I think this sets a really good foundation for the future, and I'm sure Senator Benson and I will both be watching to see how many more kids, especially, get the dental care they need to stay healthy and to have good baby teeth so that they can have good adult teeth, which is also something you all have taught me, the importance of those baby teeth and having a healthy mouth when you're little. So adding my congratulations to everyone who worked so very hard to make this happen. And the very best outcome is that people in the future in Minnesota just think that you just get good dental care in Minnesota. It just should become part of the background. And I hope that that is the future that we're looking toward here. So thank you all so much.
Good morning, everyone. My name is Trina Courtwright, and I am an advanced dental therapist working at Children's Dental Services. I am honored to be here this morning, and I am also honored to be a new member of the Dental Services Advisory Committee. Over the past 20 years, I've had a few different roles. I've worked as a registered dental hygienist. I've also been a dental educator. And now I'm in the pioneering profession of dental therapy. I owe, again, my thanks and gratitude to the innovation of Minnesota policymakers and stakeholders who made it possible for me to be a dental therapist. And now, again, through this landmark legislation, I will be able to sustain and expand care to the vulnerable, children, families, frail elders, rural residents, and even new Americans. So in short, for me, this historic legislation means that dental care for Minnesota's most underserved populations will be finally within reach. As a dental provider, an educator, and a descendant of the White Earth Band of the Ojibwe, this accomplishment is both professional and personal for me. I applaud and give thanks to all who made this possible, and I am thrilled to be part of building a Minnesota dental home moving forward. Thank you.
Well, good morning. I'm Carmelo Cinqueonce, Executive Director of the Minnesota Dental Association, an organization of approximately 3,000 member dentists. You know, in my almost 10 years of working with the MDA, I've really not seen a level of collaboration within the profession as I've seen this past year. It's been undoubtedly a most historic collaboration. And it was not just a collaboration among dental stakeholders, but a collaboration with policymakers, both with the Minnesota Department of Human Services and the state legislature. The willingness of all parties to acknowledge and, most importantly, address long-known issues associated with providing necessary and important oral health care is extraordinary. For that acknowledgement and attention, the Minnesota Dental Association is truly grateful. You know, our organization and its foundation, the Minnesota Dental Foundation, have long been champions of breaking down barriers to oral health care and to improving access to the dental community. Many of our members provide pro bono care through our foundation-sponsored programs like Give Kids a Smile, which provides over $1 million of dental care in Minnesota alone, or Minnesota Mission of Mercy, a 100-chair free dental clinic, or our members' participation in donated dental services, a national program which recently achieved a milestone of providing over $500 million in donated dental services. While these programs are extraordinary and unfortunately necessary, they by no means should be a substitute for a comprehensive oral health infrastructure. And that's precisely why the oral health successes of this past legislative session are critically important. And while we've made great strides, this is not the final chapter. Our efforts to continue improving Minnesota's oral health must be a never-ending task. And we at the Minnesota Dental Association stand ready to continue that work alongside our collaborating partners. Thank you, and congratulations to all.
Hello, everyone. I'm Dr. Michael Helgeson. I'm the CEO at Apple Tree Dental, and I'll arm wrestle for whether I'm the happiest person on this call for the successes that we've achieved as a group. But I'd just like to share one story about a senior who recently came to Apple Tree Dental's Center for Dental Health in Fergus Falls. He needed dental clearance before his cardiologist could schedule him for heart surgery. That's because untreated infections in the teeth and gums trigger inflammation, immune responses that can seriously complicate recovery from heart surgery. Unfortunately, when he came in, this patient had periodontal disease and he needed treatment right away so he could get potentially life-saving heart surgery. In recent years, the periodontal care he desperately needed wasn't covered under Minnesota's public programs, and that might have been very devastating. But fortunately, this story has a happy ending because of everyone on this call. The care he needed was approved, and he was able to get this life-saving medical and dental care that he needed. I'm forever grateful that during the last legislative session, both parties, the House and the Senate and the governor, all worked together to make covering periodontal disease a high priority. And as a result, tens of thousands of patients who not only have heart disease, but also have diabetes and many other health conditions will not only have healthier mouths, but will have healthier bodies and healthier lives. So as everyone has said here, we've taken a big step forward, but much more work needs to happen. And I'm really excited that we're in the process of designing demonstration projects that will help transform the oral healthcare system so that we can all look forward to increased access to care, improved quality, and better health and well-being for every Minnesotan in every corner of the state. So thanks to everyone. It's just been such an honor to be a small part of this whole process.
Thank you, everyone, for setting the stage. You know, this is a media event. And so I now want to work in partnership with Nancy Frank Wilson to open this up for questions from the media, because we still have Commissioner Harpstead, State Senator Benson, and State Representative Liebling on amongst the others on the Zoom call. So Nancy, how would you, what are the housekeeping items we need to know?
It'd be great if any questions go in the chat. Otherwise, if things are silent, just speak up and ask your question. That would be great. We must have done a good job. Oh, we have a question from Jill Burkham from, can you detail more specifically how the reform will ensure that the rate increases get to the dental providers instead of just giving it to the insurers who administer public programs?
I can take this. Actually, one of the things that Representative Liebling wanted was to see what the rates were paid to providers, and we negotiated to by county, so we get some sense if rates were rising. And so I think that's going to be really helpful in pushing through. But also, we set a solid mark that our insurance, that the providers, the insurance providers have to increase their dental participation. So if they want to keep these contracts, they have to do whatever it takes to meet that benchmark. And if that's pushing rates directly through, if that's lowering barriers to prior authorization, which was part of our reforms, I think that's how we're going to tell that the money is being passed through appropriately.
Wonderful.
And let me just add to that, and maybe a commissioner or somebody can kind of fill in for me, but there's also a provision in the bill, and thank you, Senator Benson, for mentioning those things. There's also a provision in the bill, we attempted to require that the money actually get passed through to the providers. So it's a little tricky to do that under our current system, but there is a provision that does attempt to do that. And you know, how easily that's going to be trackable, I'm not really sure. Somebody probably from the commissioner or somebody from DHS could probably give more specifics on that. But we did absolutely pay attention to that because it has been a concern in the past when we've raised rates and not seen the rate increases passed along.
I would just add that all the people that I thanked earlier from the department who did all that tracking for us during the bill development will be doing all the tracking now to be sure that the bill operates as it was intended to and make that data available if you need it.
We want to keep this open for the media. I know that there are some other stakeholders and who may have questions about functionality, and I'd be happy to answer those at any time at srigs@umn.edu.
Doesn't look like we have any more questions. Oh, one more. What is the cost of raising the rates and implementing the reforms, and how might federal dollars offset this?
And perhaps the commissioner knows how federal dollars are going to impact this. We looked at the general fund impact, but MA does have a lot of federal interactivity.
Right, and there's certainly a federal match for these dollars. And so that'll be an ongoing part of the plan as always. And right off the top of my head, I can't remember the total cost of the bill.
I think it was 60 million or 61 million.
It's
Carmelo?
I thought it was 54 million, but 60 could be certainly in that ballpark if there were other appropriations in there. Yeah. And certainly I don't want to speak out of turn, but I think the commissioner noted it well. So the 54 million or 60 million in new appropriations would draw down a federal match on that as well, and sort of be paid for in part by the federal FMAP program.
And I see a question about whether that's a cost per year. That's a cost for the biennium.
And of course, these are ongoing dollars. I don't have those numbers firmly in my brain either, and I knew I should have looked them up before this call. But this is an ongoing appropriation, so just to be clear. And of course, like all ongoing appropriations, you know, it's going to grow. And honestly, I hope it does grow, because we're not going to get more dental care to more people without some additional expenditures.
Yeah.
So I think we're all understanding that, you know, but I think it's what Dr. Helgeson talked about, the interaction with other kinds of healthcare services. Unfortunately, we don't account very well for those kinds of savings in our budget, but we all hope, I think, that by dealing with people's dental problems, which is really honestly a cheaper thing to deal with. Prevention is so much cheaper in this area than going and doing a heart surgery because someone has an infection. I see Dr. Helgeson's all excited by that comment, but this is something that it's just foundational. And if it costs us some more money, then that's the way it has to be.
And I think as we look at periodontal disease being included, adult periodontal disease treatment, I hope we stop seeing as many dental visits to the emergency department, and that should lower some costs. It is cheaper to treat periodontal disease than to give somebody an opioid for dental pain in an emergency department when you look at the cost all in to society.
Yeah, taking a holistic approach to the health and well-being of a patient is so critically important. We oftentimes look at these budgets as in silos and sort of what's the dental budget, what's the medical budget, et cetera, what's the pharmacy budget, and really looking at how do we treat the patient and make sure that the patient stays healthy and stays well, and essentially averts those additional costs, medical dollars that are spent when they otherwise could have been avoided by taking care of their other needs. In our case, of course, their oral health needs.
And I want to shout out to the American Dental Association and Carmelo, Senator Benson. They are providing some of those state analyses about how much is wasted by going through the emergency room. And that's a wonderful new service from the American Dental Association's Health Policy Institute. So as we, there's one long-term piece of this designing of the dental home. And we've been thinking about how can we also add in that layer of serving up to you legislators what could be the possible savings through the emergency room, because every dollar that is wasted, that goes to the emergency room, is a wasted dollar. That's for sure.
Absolutely. And we did have some of that data, and respectfully, we did have some of that data, which is why, even though it looks like periodontal treatment is a cost, in my heart of hearts, I believe it's going to save us on the other side.
I was just going to say, I can see another question in the chat here. It looks like it's from the Salvation Army. The process for billing from our clinics already serving this population, you could just continue your normal billing if you are already enrolled as a Medicaid dentist. And we are hoping that this bill causes many more dentists across Minnesota to enroll in the Medicaid and Minnesota Care programs to serve more patients.
So there is a lot of information in the chat box and some promises to deliver and distribute some more documentation about some of these issues that have come up in the questions. Are there any other questions? You can speak or type in the chat box, either way.
You know what, I just would be remiss if I also didn't give a shout out to our Representative Liz Ryer, who as a freshman legislator this year, but did a tremendous amount of work and, isn't getting a lot of credit here. I want to make sure she does, because she also did a lot of work to try to help us pull all of this together.
Thank you for that. That's in the recording, so people will hear that recognition. So I'm not hearing any other questions or comments. Anything else, Senator Benson or Commissioner Harpstead?
So just delighted with the result and eager to see how it goes.
And thank you all for your advocacy for patients and seeing the opportunity this year with some surplus dollars that we made this commitment, we raised the rates. So Minnesota is no longer the bottom, and we're holding everybody accountable for the benefit of patients in Minnesota. Thanks for the advocacy.
And I know I want to follow up with what Trina said so well. We have, you've created such great workforce innovation, also legislatively, that we so appreciate, but we feel we haven't really optimized. And so whether it's through the dental home design or other things that we may come to you. We also know that we stand committed to use those levers also that you created for us legislatively. So with that, we're just going to say thank you, and we'll now go forward with good oral health and general health, to paraphrase Commissioner Harpstead.
Thank you.
Thank you.
Bye.